guys, welcome to Tony Arnold Fit Life. Today I want to talk about something that we all struggle with, which is lower back pain. So when I get lower back pain, it's normally a lot of driving, a lot of golf. Last weekend was Easter weekend and I did all that. And so when I get my back pain, where I feel it is right here on what's called your SI joint or your sacroiliac joint. And I thought I'd share some tips on how I get rid of that when I do feel it. So most people think that the problem is in their back. Back muscles are tight, whatever. But usually when you're sitting a lot, the problem is a muscle called your psoas. And so if you think of what your psoas does, it actually runs off of your spine, but the front side of your spine. So if you're looking from the front, go deep to your abdominal muscles, deep to your organs, and what you'll see is there's a muscle under there called your psoas, runs right off the front side of your spine, right down to the inside of your thigh bone, your femur. So if we take something to help you visualize that, we're going to find, your belly button's here, and we're going to put that right there. We're going to run that right to the inside of the femur. So right along this line here is where that muscle runs on both sides. Okay, so you got one over on this side as well. The reason that's important, when you're in a seated position, as I sit down here, you can see that that is shortened. The problem with that is that's going to tug on your pelvis if that muscle stays tight, and it's going to tip your pelvis this way. So put a lot of stress on this joint here, on your spine, and on the muscles on the outside of your hips. So usually when this is tight, it can present as lower back pain, it can present as hip pain, it can present as tightness and pain in the front, but most of the time it's in the back. And so here's what you do to get rid of that. Traditional release tools like a tennis ball or a foam roller. Tennis ball is too small and too squishy. Foam roller is too big to really get in here. So what I like is a bocce ball. You could use a softball, something like that, if you don't have a bocce ball. We happen to live in Florida, and so we have bocce balls for the beach and stuff. But it's dense, so hard, and big enough to really get in deep to those abdominal muscles. So a softball will work too, but you really want something pretty substantial, pretty big, and pretty dense. So what we're going to do is I'm going to lay down here, and we're going to take this line that I showed you earlier, and we're just trying to get this ball somewhere on that line. So as we're digging in, breathing, kind of letting that ball sink in, it's going to be uncomfortable. Okay, it's not going to feel very good. You just want to get to the point where you feel that spot where it really is bothering you, and then you want to stay there. Now it may take you 3 to 5 minutes to get to where you feel like that really releases, and that's fine. That's not a problem. And then you always want to do both sides, so take it over and do the other side too. But the easiest way is to get on the floor. So we're just going to put this down, and then you can start on your hands or on your forearms like you're doing a plank, and you just want to let that ball, yeah, that's really tight. You just want to let that ball dig in right along that line and just roll until you find a spot that is really tight. And then you just want to relax, breathe deep, and let that ball sink in. Now, as this loosens up, and the more that you do, you can lay all the way down and let that sink in even deeper. And then another way to progress it is to take away the mat and just do it on like your hardwood floors or something like that. But you can't really stretch this muscle very well. There are some stretches to do for it, but if you're not releasing it, it stays so tight, and it's so tight in most of us that trying to stretch it is not going to work. You got to release it and then stretch it. The other thing is, massage therapists are great. They can work out a lot of kinks. They can do a lot of things. But I have found that when you're trying to get your psoas to release, that you really need to be in control, because it's a very sensitive area. If you are at all ticklish, if you are kind of not relaxed as somebody is trying to dig their hand under your abdominal muscles and your intestines and all that to get to your psoas, if you can't relax while you're doing it, then it's not going to release. So I found that, at least myself and with patients that I've had, that being in control of the amount of pressure and knowing the move that you're going to make as you're rolling around, instead of somebody else using their hand and you not knowing what they're going to do, really helps you to relax and release that muscle. So that's where you start. You release that psoas muscle, and then it allows your pelvis to kind of go back to where it should be, and you'll take away that pain there in your back. So give it a try. Let me know in the comments what you think.